community, firstly, because we want to prioritize rural communities, but we are also fully aware that rural people are the ones without the necessary services. They are the ones that would not necessarily get the particular services that PinkDrive issues, because one, the nearest hospital is more than 100 kilometers away, which is Mafikeng, and Mafikeng does not necessarily have an oncology unit. So we're making sure we're selecting communities that benefit. We select communities that are rural based, because that is where you get uninsured women. That is where you get women who really need the service. That is where you get women to educate. That is where you get communities to come out and also meet, not only when there is something like a funeral, but to come out and meet. So they're not only here to spread them, but they're also here to make new friends.
Rainwater Foundation is the corporate social investment of the Rainwater. So what we do community development projects. Our job is to go out to needy communities, ensure that they get all the services that they need. This is one of the projects that we do under Women's Health Program, ensuring that all the services that women would need and the health department does not have the infrastructure, Rainwater will come in to assist in ensuring that issues of prevention, issues of care, issues of early detections are taken care of.
Thanks to Rainwater Foundation for having funded us the past 4 years to go into various provinces and areas across South Africa. If it wasn't for corporate South Africa helping us, we would not be able to do what we do. More people, according to our latest stats from the World Health Organization, are tragically dying on the African continent, and that's including South Africa, of cancer, than the sum total of HIV, TB, and malaria. We will never give up hope. We are here to help all the medically uninsured in South Africa.
The work PinkDrive does is incredible, and I think sometimes we don't sit back to just show gratitude for the kind of work they do. If you think about the number of women in terms of statistics that die every single year in our country because they haven't had a pap smear, here are people who go out of their way to go to the most rural of areas to give the service.
We would appreciate it more if more time was taken to educate the people, to inform the people what the dangers of this disease are. And we would also appreciate it if a step is taken whereby the indigenous doctors are brought in on the platform so that they can also understand and play a relevant role in assisting to fight this kind of disease.
We are partnering with PinkDrive because we want to simply educate and reach out to those far rural areas where necessarily you wouldn't find services going. But because our services with PinkDrive are mobile, it is for that reason we are partnering with them to go to those far-reach areas to take our campaign on awareness around issues of breast cancer and the detection of the cancer, especially when it's still at those early stages, so that necessary attention can be given.
The week has been very, very successful. We've given out hundreds of training books, we've given out hundreds of pamphlets, we've given out hundreds of posters to communities, to community health centers, to some nurses, to some teachers, etc. All in the name of creating awareness on the early warning signs of childhood cancer, as well as the services that CHOC does for communities.
This campaign should just come back to us again, because a number of people feel that no, we didn't get a chance. At the same time, a large number of people turn up. So there were referrals. I was getting information all the time that we saw this, there's so much that has been referred. And we also see the CHOC, which is part of your group on the cancer of children. Really, we are very happy. big up to you guys.
In comparison to past outreaches that have taken place, we've really exceeded our expectations this week. Every day we've done more than 50 mammograms, and the same goes for the pap smears, clinical breast examinations and PSA testing as well. So we've really exceeded our targets for this week, and we really want to thank the Rainwater Foundation for funding this outreach and bringing the services to this much needed community.